Hello dear nursing aspirants, welcome you all to the Master Nursing classes. Myself Mr. Nagraj, your Norcet mentor and guide and AIMS Nursing Officer here in front of you all today to discuss the one more beautiful session, one more session that is very helpful for our upcoming Norcet exams. The questions that will again arise repeatedly in upcoming exams. The very important questions, the questions which require a basic knowledge, the question which require the advanced knowledge, the scenario based question, the one liner question, the important questions, each and everything that is going to arise in our upcoming Norcet prelims and mains exam, we are discussing in the master nursing classes. So do watch the video completely till the end, and who all are live for this video, so try to be involved completely during the session. Try to give our best answer, and who are all not live, so watching this video after uploading completely, so those people also keep commenting the answer in the comment box. The comment box is free for you all. So only mention the answer in the comment box. Okay. So and if you have the any doubt, minor doubt related to the any question, you can just comment in the comment box. I will respond to your answers questions whenever I will get the time. Okay. So without wasting the time, we will start the today's class. Today's the very important questions. The questions definitely will arise this in the all upcoming exams. Okay. So here is the first question of the day. Yes, read the question carefully and try to give your best answer for this question. The question is very simple. The medical terminology used to determine the peritonsillar abscess. What happening here? What is the peritonsillar abscess? Peritonsillar in the sense, peri means surround the tonsils. Okay, peritonsillar in the meaning that is surrounding the tonsil. There is an accumulation of the pus is called abscess. So one word we will use to determine that indicates there is an abscess accumulated around surrounding the tonsil. So that is what we call that version periodontitis. No students. The periodontitis, the meaning of the periodontitis is, can anyone tell? Dentitis means the teeth. Inflammation around the teeth, that is the dentitis. Means the gum which is surrounding the teeth, if there is any getting any infection and accumulation of the pus around surrounding the teeth, we call that one as in the periodontitis. Okay, peri means around surrounding, odontitis means the inflammation, infection along with pus accumulation. Okay, so that is the periodontitis. Is this group? No, group we have already studied. The what is the parts which all are involved in the group? Yes, you can remember by lung TB. Okay, laryngitis, tracheitis, and bronchitis. LTB is the all together we call this one as in the group. Okay, the patient, if the child is suffering from laryngitis, tracheitis, and bronchitis, so we call this one as in the group, and the barking cough is the classical sign of the group. Okay, so yes, all are giving the option C is the correct answer for the question. That is the quinsy. The quinsy, that word we are using to determine the peritonsillar abscess. Yes, students, very good. Who all are given the option C? Yes, very good evening to all. Very good evening. Very good evening. Yes, all are given the option C as a correct answer for this question. Your answer is correct. That is the answer for this question. The term which we are using to determine the peritonsillar abscess is the quinsy, and what is the rhinitis? And tell me the most common cause for the rhinitis. Yes, rhinitis is very simple. We can call this one as in the common cold also. Common cold. Okay. So this occurs due to the viral infection. The name of the virus is, can anyone comment the name of the virus that is responsible for the rhinitis? The infection and inflammation of the nasal mucosa, that is the rhinitis. Yes, can anyone tell? Very good. So, viral cause, if the examiner asking, means the most common cause is the rhinovirus. Okay, rhinovirus. Very importantly. And mostly the rhinitis occurs not due to the rhinovirus, that occurs due to the allergy. So that one we call as in the allergic rhinitis. The most common type of rhinitis is the allergic rhinitis, and the most common cause for rhinitis is the, yes, the viral cause of the rhinitis is the rhinovirus. Very importantly. Okay, I hope all the questions related to all options we have discussed here. And here is the next question for you all. Yes, try to give the best answer for the question, and this is the 5-star question, and this question definitely come in our Norcet 6 exams. Yes, what is the question? The ribavirin nebulization is used to treat which of the following condition? Yes, which of the following condition among the 4 conditions? There is the diphtheria, epiglottitis, bronchiolitis, and pneumonia we are having in the options. Among these four, in which of the condition we are using the ribavirin nebulization? Yes, can anyone tell? Ribavirin nebulization is used to treat which of the following condition? Is this diphtheria? No, students. We will not using the diphtheria. Not in epiglottitis also. Not in pneumonia also. Yes, the only one remaining option, that is again option C is the correct answer, and who all are given the option C as the correct answer for this question, your answer is 100% correct, and this is very very important question, students. This question is updated question. This question is the recently updated question, and this question will definitely come in all the exams, not only in Norcet, upcoming all exams like BHU, ESIC, AIMS Norcet, AIMS SNO, and all the state and central government exams, the ribavirin nebulations, they will ask the question in which situation we will use the ribavirin nebulation, that is in the bronchiolitis, the infection and inflammation of the bronchioles. So at that point of the time, we will use the ribavirin nebulation. Okay, ribavirin is the antiviral drug, students. This is an antiviral drug. So we will nebulize the patient with the ribavirin, where the antiviral drug inhales the patient and the antiviral effect enhances in the bronchiolitis, where the we will give to destroy this one as the respiratory syncytial virus. Okay, against which virus we will give the ribavirin nebulization here? That is the respiratory syncytial virus. The most common cause of the bronchiolitis is that is respiratory syncytial virus. To destroy this respiratory syncytial virus, we will give the ribavirin nebulization. Okay, this is the antiviral drug. Hope that everything is clear about this question. Okay. Yes, so all are given the option C as a correct answer. Very good, students. The bronchiolitis, where we are using the ribavirin nebulization. The 5-star question, it will come in the IMNCI upcoming exams. Okay, very important questions. Here is the next question. Yes, read the question carefully, completely, and try to give our best answer. And this is related to the, yes, the question is related to the IMNCI program. Yes, that is the, yes, the question is very simple. Understand the question and read the option and try to give your answer. I am waiting for your answer in the comment box, students. Fatapat, try to give the answer for this question. Which of the following color code is used to categorize the severity of the childhood and neonatal illnesses under IMNCI guidance? Yes, what is the IMNCI? That is the integrated management of neonatal and childhood illness. Previously, in foreign countries, this program is running as in the IMCI, students, not IMNCI. This is the IMNCI, Integrated Management of the Childhood Illnesses. In the foreign countries it's going, and in the India it's going as in the IMNCI. Why? Because the most common contribution, the most important contribution for the under 5 mortality is the neonatal mortality rate. So in order to control the neonatal mortality rate, we are included the neonate also in the IMNCI program. So here we are integrately, means combinedly managing the childhood and neonatal illnesses under this program. The program name itself says integrated management of neonatal and childhood illnesses. Both neonates and childhood illnesses we are treating under the IMNCI program. And in order to categorize the patient based on the severity, we are using the 3 colors in the IMNCI. So among those 4 options, one color we are not using. And the question is asking us the same. Which of the following color code is not used to categorize the severity of the childhood illnesses, childhood and neonatal illnesses under IMNCI program? Yes. Can we use pink? Pink, green, yellow. P is pink. You can remember pink, yellow, and green are the color we are using to categorize the child with the neonatal and to categorize the neonates and childhoods based on the severity of the disease. Okay, where in the pink, in the yellow, and in the green. If the patient comes with the severe sign symptoms, if the child comes with the severe sign symptoms with danger signs, so we will categorize the child under the, yes, that is the under pink color, and we will refer the patient. So examiner will ask the question, in which pink, in which color under categorized IMNCI child, you will refer to the higher center. Whatever the child, he will comes under the pink color categorization, means the severe sign symptoms with the danger signs of the disease. So that child, we will stabilize the child at the PHC level, and from the PHC we will send the child to the higher centers like CHC and for district hospitals, because the patient is manifesting a danger signs, means the always danger sign indicates the life threatening conditions. In order to save the life of the child, we will refer the child who are coming under the pink color categories of the IMNCI program, and yellow is the color where we are identifying the severity of the disease and we are admitting the child to the PHC only and treating the treating in the PHC by admitting. And whenever the child will come with the minor and mild illnesses, okay, at that point of the time we will counsel the parents and we will send back the parents to the home and will advise for the home based care. The question is arise like in which color category of the IMNCI the home based care is given. That is under the green color categorization, we will give the home based care. And in which situation we will admit and treat in the PHC. In the yellow color categorized child, we will admit and treat in the PHC only. And in which color we will stabilize and refer to the higher centers. In the in the pink color categorized child, the child with the danger signs of the disease, we will stabilize and refer to the higher centers. So pink, green, yellow, all these three are the part of the our IMNC and whole are given the option D as the color correct answer for the question. The black is not a part of the our IMNC program. So the question will arise in the exam. Very important one. Okay. So here is the next question. I hope the IMNC is helpful for everyone. The examiner may ask the full form of the IMNC also. That is the integrated management of the neonatal and childhood illnesses. Okay. The color codings you can remember by pig. PYG pig, not PIG pig. That is the pig. P stands for pink, Y stands for yellow, and the green G stands for green. Hope the concept is very clear for the question. And here is the next question for you. Okay. Yes, read the question carefully, completely, and try to give the best answer for the question. Yes, which of the following condition is not contraindicated in patient with the acute epiglottitis? So among the four options, so condition where we are not considering as an contraindication in the acute epiglottitis. What is the acute epiglottitis? Acute epiglottitis is an acute inflammation and infection of the epiglottis where there is it obstructing the airway partially and the classical picture is the stridor. Okay, stridor due to the partial blockage of the upper airway. So we will have the stridor here. Okay. So among these four, we have to know which one is contraindicated. Students, in the child with epiglottitis, we will never ever try to assess the oral temperature. We will never ever take the throat swab, and we will never ever take the try to visualize the posterior pharynx. Why? Because when we stimulate the oral temperature, when we stimulate the mouth with throat swab, and when we will try to assess for the posterior pharynx, there is a chance of complete blockage. Where in the acute epiglottitis, half blockage is there, and the child is feeling suffer, and he is feeling that his airway is blocked. So when we will stimulate more by assessing the oral temperature, throat swab, and visualization of the posterior pharynx, when we are putting some instrument in the mouth and all, so that stimulates, and there is a chance of the complete blockage of the airway by the bronchospasm. So oral temperature is contraindicated in the epiglottitis patient. Throat swab is contraindicated in the epiglottitis patient, and visualization of the posterior pharynx also is contraindicated in the epiglottitis patient. And the heliox, we will use this one as in the treatment of the patient with the acute epiglottitis, where we are using the helium plus cold oxygen. Okay, cold oxygen in order to establish the airway, where the helium prevents the blockage of the airway and where the oxygen will supplies to the our lung and from the lungs to the entire body tissue, where the oxygen demand will decreases and the respiratory efforts will decreases. So because of that, cold oxygen with helium is the treatment we are using in the patient with the yes acute epiglottitis. So together this one we call as in the heliox. So heliox is the helium plus oxygen is the preferred treatment in the epiglottitis patient, and all these three option A, B, C are the contraindicated in the epiglottitis. Never ever use the throat swab, oral temperature, and visualization of the posterior pharynx. All those things are contraindicated in the acute epiglottitis. And who all are given the option D. This one is not contraindicated. Okay, not contraindicated means this one is the not contraindicated, and this is the treatment. So option D is the correct answer for the question. Okay, very best student, very good. So here is the next question for you all. Read the question carefully, completely, and read all the options till the end, and try to give the best answer for the question. Yes, very simple question. Fadafat read the question and try to give the best answer for the question. Yes, the most common complication of the cystic fibrosis in the newborn. What is the most common complication that is in the considered as in the most common complication? Most common complication of cystic fibrosis in the newborn. So what happens in the cystic fibrosis, students? As I told already that cystic fibrosis transmembrane regulator gene or the cystic fibrosis transmembrane regulator protein mutation. So because of that, there is no return of the sodium and chloride from the sweat gland to the blood or the interstitium of the body. So the sodium and chloride will excrete through the sweat a lot. And in main problem is that in the exocrine gland ducts there is excessive accumulation of the thick mucosa, so which blocks the multiple system ducts, especially the biliary duct, especially the respiratory tract, especially the fallopian tube, where it causes the multiple clinical manifestation based on the site of the obstruction by the thick mucosa. So now you have to identify the most common complication of the cystic fibrosis in the newborn. In a newborn, yes, is this the deficiency of the vitamin A, D, K, E? Sorry, A, D, E, K. Yes, the deficiency of the A, D, E, K occurs in the cystic fibrosis because our cystic duct is blocked and the bile juice is not coming to the intestine, and the bile juice is not coming means the fat is not emulsifying, means the fat is not absorbing, means the fat soluble vitamins also not absorbing. Because of that, all the fat soluble vitamins A, D, E, K deficiency occurs in the cystic fibrosis, but this is not most common complication. Option A is the, sorry, option B is the atelectasis. There is then the collapse of the alveoli because of the accumulation of the thick mucus in the alveoli. Yes, is this one also in the complication, but this is not most common complication. And option C is the meconium ileus. Yes, very good students who all are given the option C as the correct answer for the question. Your answer is very 100% correct. The most common complication of the cystic fibrosis in a newborn is, that is the meconium ileus, the very important pediatric question that will arise in our upcoming Norcet exam. And yes, stunted growth also occurs because of the, yes, less fat absorption, and because of the less exocrine gland secretion, and because of the continuous airway obstruction by the thick mucosa and less oxygenation. There is the stunted growth is also we will evidence, but this is also not most common complication. And these all are the complication or not means, yes, these all are the complication but not most common. And the most common complication is the option D for the question, that is the meconium ileus is the most common complication of the cystic fibrosis in the newborn. The answer for the question is very clear, I think so, and I am moving forward for the next question. Here is the question. Yes, try to give the best answer for the question, and the very important question this one. Okay, yes, I am waiting for your answer in the comment box. So read the question carefully, fatafat, and try to give the best answer for this question. Which of the following is not a component of the nursing diagnosis? Very simple and faster question. Very simple and faster question. Yes, problem, etiology, sign, symptom, and evaluation. Among these four, which one is not considered as the components of the nursing diagnosis while making the nursing diagnosis? Yes, very good students. Who all are mentioning the option D? Okay, done. All are mentioning the option D as the correct answer. That is the evaluation is the 100% correct answer. We are not considering this one as in the component of the nursing diagnosis, where the nursing diagnosis is always based on the PES, the standard mnemonic. That is the problem, etiology, and sign symptom. And the sequence also in this one only. First we will mention the problem, then we will mention the etiology, and we will mention the sign symptom. I will give the example, and you have to identify. So which among the based on the given nursing diagnosis, you have to identify the, yes, problem, etiology, and sign symptom for the question. Here is the example, that is the hyperthermia, hyperthermia related to epiglottitis, as evidenced by increased body temperature. So here is the problem is, yes, can anyone tell the problem is etiology and sign symptom? Now tell me, comment fast, patapat. So in the given example, which one is the problem? Is this hyperthermia or the epiglottitis or the body temperature is the problem? Which one is the problem? Problem is the, yes, that is our hyperthermia is the problem. And etiology is, what is the etiology? Yes, very good students. That is the Epiglottitis is the etiology. Yes. Then what is the sign symptom? Sign symptom is the yes, increased body temperature is the sign symptom. So this is how the PES work. This is how the modulation and the preparation of the nursing diagnosis happens. And nursing diagnosis should be realistic one. Nursing diagnosis should be a problem solving purpose one. And nursing diagnosis should be time bounded, and it should be flexible, and it should be based on the priority. Very very important. These three things. Yes, who all are commented. Yes, very best student. Your knowledge is very solid. So this is the PES we are using as a problem, etiology and sign symptom. So here is the among given options. The problem is the hyperthermia, etiology is epiglottitis, and the increased body temperature is the sign symptom. So this is how our nursing diagnosis will be formed, and the components of the nursing diagnosis will ask in the exam. That is the PES, the problem, etiology, sign symptom, and evaluation is the part of the nursing process. Yes, how many parts of the nursing process are there, and who is the founder of the nursing process? Can anyone tell? Yes, do comment the answer. And the founder of the nursing diagnosis is, sorry, the founder of the nursing process is, yes, who is the founder of the nursing process? Yes, very good students. There is the Ladia Hall. Ladia Hall is the founder of the nursing process. And for nursing diagnosis, which one we are using the current guidelines? That is the Nanda guidelines. What is the Nanda here? North American Nursing Diagnosis Association. Okay. So very, very important. North American Nursing Diagnosis Association. Yes, we are using the Nanda first phase and second phase. So among this one, first phase is completed and second phase we are using as a current. Okay. So that is the Nanda second phase is the current we are using the for the guidelines for our nursing diagnosis. Okay. So hope the very easily you people have understood the question. Okay. So here is the next question for you all. Yes. The question is already just discussed on the above question only. Who is the pioneer of the mention the word nursing diagnosis? Wherever the word pioneer is coming, so that the meaning of the pioneer is very simple. That is who identified it first time. Okay, who identified it first time? Yes, among the four these personalities, you have to tell the pioneer means the person who identified first time the word nursing process. Yes, just now only we have discussed the question. Do answer comment in the comment box. Fatapat we will go for the next. Okay. Yes. Is this Ignaz Semmelweis? Is the no students. Option A is not correct answer. Yes. Option B, Lydia Hall is the founder of our nursing process. Who all are giving the answer? That is correct. And Ignaz Semmelweis is the father of hand washing. Is the our Ignaz Semmelweis. That is the father of hand washing and the founder of the hand washing. And Robert Koch is the father of the bacteriology. And who is the Alexander Fleming? Alexander Fleming is the person who discovered the antibiotic first time. Who discovered the antibiotic first time? And which antibiotic that one is? Yes, that's the Alexander Fleming is the person who discovered the antibiotic first time, and the name of the antibiotic is the penicillin. Okay, penicillin is the first antibiotic which is discovered by the Alexander Fleming. Okay, that is the penicillin G, which is discovered by the Alexander Fleming, and so here is the founder of the antibiotics. We can say. Okay, so here is the next question. Hope the question is very clear for this one, and the answer for this question, the pioneer to use the word nursing process is the that is our Lydia Hall. Okay, so here is the next question for you all. Read the question fatafat carefully, completely, and try to give our best answer for the question. I am waiting. Yes, I am waiting for your answers in the comment box, students. Fatafat read the question. The assessment done after the initial assessment to collect the information related to the specific problem for which the patient admitted to the hospital. Yes, option A is the initial assessment. Option B is the problem focused assessment. Option C is the emergency assessment. And option D is the time lapse assessment. So among these four, which one is the assessment where we are doing in the initial after the initial assessment? So we are doing the assessment after the initial assessment to collect the information that is related to a specific problem for a patient with for which the patient admitted to the hospital. So we need to identify the problem for the patient admitted with the chief complaints to the hospital means that one is yes is this initial. Now students, in the initial we will collect all the data, not only specific problem related data. In the initial assessment we will do the yes all the demo, we will collect the name, and all the demographic details of the patient. Okay, and age, sex, occupation, married, unmarried, religion, food pattern, and all medical history, surgical history, each and everything will take in the initial assessment. So initial assessment is also called as in the comprehensive assessment also. Okay, and so option B is the problem focused assessment. Yes, the problem focused assessment is the assessment we are doing after doing the initial assessment, and here in this problem focused assessment, the assessment is only on the patient problem for which he is admitted to the hospital. Okay, so like the patient is admitted to the hospital with the diagnosis of the pneumonia. So now our mm, assessment is not starts with the head and ends with the head. In the initial time only we'll start with the head and ends with the foot, and after that only problem focused assessment we'll do after the initial assessment. That is wherever the problem is there. So at that part only we'll assess specially. Okay, in the pneumonia the problem is in the lungs. So we'll assess the saturation of the patient. We'll assess the respiratory rate of the patient. We will assess the chest configuration, and we will assess the yes the involvement of the intercostal muscles are there, means our focus is on the problem. Okay, so that is very necessary to the describe in detail and understanding better and give the proper treatment for the our disease condition. Okay, so this one is the problem focused assessment. Then what is the emergency assessment? Emergency assessment is the assessment we are doing in the situation with a life threatening condition, where for the all patient we will approach with the airway breathing circulation, and yes, airway breathing circulation, and what else? That is the disability, exposure, and environmental control. Okay, so these all are the primary survey. Secondary survey we will do in the emergency assessment, and this one is not an emergency assessment. Emergency assessment we will do in the situation where there is arrangement of the life threatening condition is there. So at that point we will do the emergency assessment. So then what about the time lapse assessment? Okay, what is the time lapse assessment? For better understanding, I will draw one small diagram here. Here is the person who is admitted on the yes, who is admitted to the hospital on the 28th one, and so on that day we have assessed the entire demographic data of the patient. We have collected the data for the baseline information, and on 30th, after completing the his treatment, so we are again assessing the patient, and we are again collecting the data, and we are comparing the data. We are comparing the data which is we collected on the 30th, and which were we are already collected on the 28th, in order to see the improvement in the patient condition. So the time lapse assessment is there. So to do the time lapse assessment, the basic assessment is very required. The person when the on the day of admission we need to assess the patient completely. Then after treatment again means after some time. So again we are assessing and comparing that data to the first data which were collected during the admission, and in order to determine the prognosis of the patient. So this is a time lapse assessment. Okay, hope the concept is very much clear for the option D also. And I'm moving forward to the next question. Yes, the very important and very basic question. Yes, who are the given the correct answer for the question as in the option B. So your answer is very much correct. That is the after doing the initial assessment to collect the specific problem related data for which the patient is admitted to the hospital. So that is the very importantly the problem focused assessment. Okay, and here is the next question. Yes, the question is very simple and very best question. Try to give your best answer for the question. Yes. I am waiting for your answer in the comment box, friends. Yes, read the question completely, carefully. Read all options also and give the answer for the question. Yes, which of the following will come first in sequence of physical examination technique while assessing the abdomen? Students, wherever the we will do the assessment in the body. This is a different type of the human being. For the better understanding, I am drawing like this. Don't worry. Okay. Wherever the assessment we will do, we are having the four techniques of the assessment. First, we will observe the patient, means we will inspect the patient, and then we will touch the patient and we will feel the problem of the patient, that is the palpation, and we will tap over the patient, and we will assess for the sound for the identifying the underlying problems, and we will do the auscultation at the end, and this one is the sequence for the all patients. Okay, while assessing the entire system that including the CNS or face, neck, thoracic cavity and all. But while assessing the abdominal cavity, we will assess the yes. Which one is the first? For assessing the all from head to toe, the first is always and always inspection. And after inspection, while assessing the abdominal cavity, we will do the auscultation. Why? Because the bowel sound is very sensitive sound, and which will alter. So if we do the palpation percussion first before the auscultation, means the sound will come false. So because of that, so after inspection directly we will go for the palpation, then we will do the percussion, and the palpation we will do the at last, and the auscultation we will do at the place of the percussion. Okay, if the examiner asking the sequence of abdominal assessment techniques. Okay, the first one is always and always inspection. After the inspection, we will do the, yes, that is very very importantly, auscultation. Then auscultation, we will do the percussion. The percussion remains same in the, okay, remains same in the one place, and after that we will do the palpation. Okay, so in the place of the palpation, auscultation will come, and in the place of the auscultation, the palpation will come only in situation of the abdominal assessment. Why? Because before auscultation we were doing the palpation, means the bowel sound abnormally, it may be high or it may be low, so we don't want to stimulate the bowel, we want to hear the natural sound. So because of that, we will never ever palpate before the auscultation, only during the abdominal assessment. And rest all other than the abdominal, first we will do the inspection, then we will go for the palpation. Okay, so then we will go for the percussion. Okay, and then we will go for the, yes, that is the auscultation at the last. Okay, so but only during the abdominal assessment, inspection is first, then auscultation, then percussion, then palpation. Okay, so this is how the sequence will arises. And the important question also will arises, which of the following will come as a first in sequence of the physical examination technique while assessing the abdomen. While assessing the abdomen, yes, the inspection will always remains first in all the assessment techniques. Then after that, yes, I have discussed the sequence also. So answer for this question will go to, that is the, our inspection remains the same answer for the question. Wherever the, it may be abdomen, it may be thoracic, it may be in the upper extremity, lower extremities, CNS, whatever you want to, you can assess. But always the first technique you will use is the inspection. Okay, okay, and this is the normal sequence in all the system, and the sequence which we have discussed during the abdominal is only different. So we have discussed it already. Okay, so I'm moving forward to the next question. Yes, the next question is very simple and very important question. Yes, they read the question carefully, completely, and try to give the best answer in the comment box. Fatapat, I am waiting for your comment. Well, while preparing the patient for the contrast induced scan, which of the following cannula for to be inserted? Is this 14 gauge, 16 gauge, 18 gauge, 20 gauge? Yes, which gauge cannula you will insert? Can anyone tell Fatapat for the answer? Yes, which gauge of the cannula you will insert in the patient who is undergoing the, yes, the contrast induced scan. Contrast induced scan, what happening here in the contrast induced scan? We are injecting the some contrast chemical, some radioactive chemical through the veins. Okay, so to inject the contrast or the radioactive chemical through the veins, which of the following cannula you will use among the given four options? Is this 14 gauge? 14 gauge is the orange in color, and 16 gauge is the gray, 18 gauge is the green, 20 gauge is the pink, and 22 gauge is the blue, 24 gauge is yellow, and 26 one is the purple. So for the pediatric and infants, we will use the yellow. Okay, and for the emergency purpose in the children's from between the age of the 6 to 18 years, so we can use the green, blue also. Okay, so that is the route for routine IV infusion. We will use the pink, and in case of the blood transfusion, in case of the contrast induced scan, in case of the pre-operative procedure, okay, and in case of the anesthesia induction, we will use the, that is the 18th gauge cannula. Okay, very very importantly, that is green in color. Okay, so then what else? The 16 gauge cannula, it is used in the emergency. So which cannula we are using in the emergency situations for the rapid fluid correction? That is the gray color. Yes, the 16 gauge cannula, and 14 gauge cannula we will use rarely and rarely. Okay, very rare. Okay, so the 16 gauge used in the emergency for blood transfusion, 18 gauge for contrast induced scan, 18 gauge for pre-operative procedures, 18 gauge. Okay, for anesthesia induction, 18 gauge for pink, that is for the routine IV infusion, and blue for the 6 to 18 year childs, and below the 6 year we can use the blue or yellow. Okay, so yellow is the list we are using in the infants. Okay, in cannula of the choice in the infants is always yellow color. That is the 24 gauge cannula. Okay, very importantly, we have to remember the color coding and the gauge of the cannula, and remember wherever the number of the gauge decreases, the length of the cannula increases. Wherever the number of the gauge decreases, the length of the cannula increases, and the width and internal diameter and external diameter of the cannula also increases. Okay, only the number decreases, the length, size, and size of the cannula increases. Okay, hope the concept is very clear. And here is the next question for you all, and the answer for this question, as all of you know, that there is the 18th gauge cannula we are using for the, yes, the contrast induced can, very important. Okay, so here is the next question for you all. Read the question carefully, completely, and try to give the best answer for this question. Yes, which of the following is the criteria to accept the verbal and telephonic order? What happens as a nursing officer? You are working in the on ward, okay, and one patient suddenly collapsed and he fell in the ground. So now you are calling to the doctor is not on duty. Doctor is not there in the hospital. So you are calling to the on duty doctor. Okay, so he is outside the hospital and he is telling that, so insert the 16 gauge cannula, or insert the 18 gauge cannula, and start the rapid IV fluid infusion. So to accept these orders, what are the criteria is there? Is this the doctor is telling like this, we will accept that one? No, students. There is some techniques we are using in order to prevent the medication error. So that techniques the examiner is asking in this question. Yes, the criteria to accept the verbal and telephonic order. What are the criteria is there? Yes, very importantly, only in the critical and life-threatening situation the orders are accepted. Yes, very importantly, students. Not routinely the doctor is sitting in the home and he is telling that to do this one, that one. No, we will not accept that one until and unless it is an emergency situation. Okay, so we'll accept this one only in case of the emergency situation. Okay, yes, this one is true statement. Yes, this is a true statement. And option B is that, yes, after using a read and repeat back policy, and on duty doctor is telling to give the, yes, IV fluid, normal saline, 2-pint bolus, followed by 50 ml per hour. He told like this in speed. Okay, you heard that 2-pint bolus. That's it. You are didn't hearing the 50 ml per hour means you are not infusing the 50 ml per hour rest of the fluid means, so the patient again may will go for the collapse. So whenever the doctor will tell that one, you have to read, you have to write it that in the doctor's notes. Okay, and you have to read it and repeat it back to the doctor. Okay, you have to tell that. So this is the order you have to tell. Just for the confirmation, I am reading and repeating it back. Okay, that is the NS 2-pint bolus, and after that the 50 ml per hour is the, yes, continuous you have to go. Yes, that is the read and repeat back. You are reading the whatever the doctor told you. You are reading and repeating it back to the doctor, and after giving the confirmation, you have to start the infusion. Okay, so then option C is the word to word order. So while accepting the telephone order, you have to write the word to word order. Okay, word to word order sense, he will tell in Haribari the pint of 40 mg IVBD. It will not accept tablet or injection. You have to assess. Ask means the word to word you have to write. That is the injection. Pant up, you have to write the pant up. 40 mg, you have to write the 40 mg. IV, you have to write the IV. BD, you have to write the BD. Okay, like this. So each one word to word we have to repeat and we have to confirm and we have to write in the drug. This is the criteria. Very importantly, only in the emergency situation. Okay, and read and repeat back policy is very important. Word to word copy is the very important. And one more thing, whoever the doctor who told the order, he should come within the, yes, 24 hours and he should sign the order where he have advised in the telephone. So we will mention and we will consider this one as the telephonic order only. We will mention that one. Okay, telephonic order, and within 24 hours the doctor, the on duty doctor will should come and he should sign on the order whatever he told in the emergency. Okay, so in this one, the all the above is the correct answer for the question, and who all are mentioning the all the above as the correct answer for the question. Yes, very good, students. This is the how we will learn single thing. This is the how we will learn the practical thing. This is the how we will learn the situation based things. Okay, and we will move forward and we will crack the exams. Okay, so don't worry, the master nursing classes always will be with you. Always we will keep supporting you. for each and every steps of your journey. Okay, so you have to do is to yes reading the properly, taking the notes properly, and revising it properly. Okay, that is the only thing which will make you a champion. Okay, here is the next question for the day. Yes, this one is the very simple question. Yes, in the heterogeneous mixture of the solution, okay, where solid is mixing with the liquid is known as, yes, what happening here? So heterogeneous means two different kind of the solutions we are mixing, like oil plus water, where the oil also liquid and water also liquid. So two different components we are mixing means we call this one as the heterogeneous. Homogeneous solution means water plus water, oil plus oil we will mention. Okay, heterogeneous means oil plus water means two different components we will mix. Okay, so when two different components we are mixing, while mixing we are mixing liquid plus liquid means we call this one as in the emulsion. Liquid means plus liquid is the emulsion. Here in this given situation, the solid plus liquid is there. Solid plus liquid is the, yes, solid plus liquid. This one we will call as in the, that is the suspension. Okay, very important. You have to keep in your mind. This question also will come in the exams. Okay, so here while giving the suspension or while giving the emulsion or while giving the syrup to the patient, it is very mandatory to mix thoroughly the solution which is there. Why? Because if it is in heterogeneous solutions, the particles will settle down at the bottom of the bottle. So whatever the medicine you are giving just like water or just like a oil. Okay, you are not giving the drug means it is not going to be very helpful. So before giving the syrup, emulsion, suspension, you have to make sure that it should be mixed thoroughly by rotating in between the palm or by making it up and down twice. Okay, very importantly, it should be mixed completely. Then only we will pour in the measuring cup and will give to the patient. Okay, very importantly, we will do like this. Okay, and make be sure that, so consider this one as in the syrup. Okay, syrup bottle, and on this side they have labeled, yes, that is the syrup, like syrup ambroxyl. Okay, and composition of the ambroxyl they have mentioned the label this side means we will use the opposite side of the bottle to pour the solution. Why? Because while pouring the solution the syrup will come like this, and if it is coming on the label means it will destroy the label. So the syrup is not used for only once time, the syrup is used for the multiple times. Okay, means for the 15 days, for the 20 days we will use the same bottle. So while giving the first time it is okay and it is the label is okay, we are reading and giving. While giving the second time, if the syrup is on the label means we are unable to read the composition, the dose, okay, of the syrup. So we'll come to the conclusion to discard the syrup. So in order to prevent the wastage of the drug, so while pouring the syrup, you have to make sure that the label should be opposite side. Okay, this is the situation based question. Again, it will come in your exams. Okay, so this is the liquid plus liquid, where the oil plus water I have given the example as in the emulsion, and the solid plus liquid, yes, the solid plus mixing with the liquid is known as the suspension. And what is the lotion? What is the liniment? Lotion is the, yes, the soapy material where we are using to apply over the skin without rubbing. Wherever we will apply the lotion we will not rub. Why? Because we don't want the systemic effect from the lotion. So because of that, the lotion is always only used for the local. Okay, so the lotion is not rubbed vigorously after applying. And what is the liniment? And can anyone give the best example for the liniment? Liniment is the, yes, that is the semi-solid to solid thing where we are applying on the skin and we are rubbing. Like semi-solid we can say the gender balm. Okay, can all, I think all of you have used the gender balm. Okay, gender balm is the example of the liniment where we are applying and rubbing. So in the lotion no need to rub, and in the liniment we need to apply and rub where we want the systemic effect of the liniment. So the option example also very generally used thing I have told, that is the gender balm. Okay, so very importantly you have to understand this situation. Yes, here is the question. Next question for you all. Yes, the last answer for the last question. Hope everything is clear. That is the suspension. And here is the next question for you all. Just read the question carefully and completely read the option till the end and give the best answer for the question. Yes, that is the, yes, which of the following is not considered as in the exposure risk in HIV positive patient. So this is the HIV positive patient. From this patient, the saliva is coming, the tear is coming, okay, the sweat is coming, the feces is coming, the urine is coming, and some body secretions also coming. So among all the secretions, what all are we are considered as in the risk of the exposure? Okay, where these secretions we are exposing means we will getting the risk of the HIV infection. Okay, so among these ones, we need to consider as in the not a we need to identify which is not an exposure comes under the exposure risk. Yes, we are exposing to the blood of the HIV positive patient means yes, this one creates the exposure risk. And vaginal fluid also creates the exposure risk. Synovial fluid also consider the exposure risk. And saliva, vomiting, sweat, vomiting, saliva is not considered as in the exposure risk of the HIV patient. If we are exposing the saliva, if we are exposing the vomiting and sweat of the HIV patient, we will not get the infection by the HIV. So we will not consider this one as in the exposure risk for the HIV positive patient, where the blood, vaginal fluid, synovial fluid is considered as in the risk of the exposure to the HIV infection if we are getting exposed to the positive patient. Okay, so hope the concept is clear for this question also. And yes, what is the disease which occurs due to the HIV infection? The name of the virus is the HIV. And what is the name of the disease? That is the, can anyone tell the full form of the HIV? Yes, that is the human immunodeficiency virus. Okay, so what happens here in the human immunodeficiency virus means it will destroy our immune system. So which cells they will target? They will target the CD4. That is the cluster differentiating for number 4 cells. So this target these cells they will target and they will destroy the CD4 cells. And when the HIV infection is a chronic, so we call this one as the AIDS. So can anyone tell the full form of the AIDS? Yes, that is the acquired immunodeficiency syndrome. What is the full form of the AIDS? That is the acquired immunodeficiency syndrome, and full form of the HIV is the human immunodeficiency virus, and it will target on the very important immune cells, that is the CD4 cells. Okay, very important. Other questions may arise from the HIV. Can anyone tell the what is the confirmatory diagnostic test for the HIV? Yes, is this the viral load test? Is this the ELISA? Is this the Western blast test? Can anyone comment in the answer? What is the confirmatory diagnostic test for the HIV? Already it is there in our quiz. So, and one time we have discussed in our class also. And the question I have, I think so 3 days back I have mentioned the question in our quiz also. Yes, what is the confirmatory test for the HIV? Yes, very good students who all are writing the Western blast as the answer for the question. The Western blast test is in the yes the confirmatory and the diagnostic test for the HIV. And so all of you I think know so that we are considering the very important questions for the our all the upcoming central government exams. Yes, any problem? Okay, no. Okay, so we are conducting the very beautiful quizzes in our Telegram group. So the Telegram group is there in the link. If you are not a part of our Telegram group, you can join to the Telegram group also. The quizzes are the very free. Okay, no any single rupees cost we are taking for the quizzes. The quizzes are the daily. It will uploaded in the morning. Okay, so it will be available throughout the day. And if you want a part of our daily quiz where we are discussing the very important questions for our upcoming Norcet, so do join the Telegram group and attend the daily quiz. And who all are already a part of our Telegram group, so be active in the group and try to attend the all quiz. Okay, so very important quiz we are posting on daily basis. Okay, so the answer for this question is the saliva. Saliva is not considered as the exposure risk for the HIV. Okay, yes, here is the next question for you all. Read the question carefully, completely, and try to give your best answer for the question. What is the recommended post exposure prophylaxis in unvaccinated healthcare provider with needle stick injury from HBsAg positive patient? What happened here, students? So, one unvaccinated means for all healthcare providers will give the hepatitis B vaccine for all the healthcare provider. So, one healthcare worker is unvaccinated. So, unvaccinated healthcare worker, she now got the needle stick injury from the patient who is HbA1c positive. So now what is the post-exposure prophylaxis? Post-exposure prophylaxis means after exposing to the some risk that may be due to the body fluids, that may be due to the needle stick injury. So we will protect ourselves. We will protect the healthcare workers who underwent the exposures. So what is the post-exposure prophylaxis? You will use to unvaccinated healthcare provider with needle stick injury from HbA1c positive patient. Option A is the only first aid. Is this only first aid required? No students. The healthcare worker is unvaccinated, so only first aid is not necessary. So we will do the first. What we will do? We will first do the first aid. Okay. What is the first aid we will do in the needle stick injury? We will keep the finger or we will keep the part which is underwent the needle stick under the running tap water. Okay, but after cleaning with the soap solution. Okay, for the duration of the 10 to 15 minutes, we will expose to the under running water. Then after that, so the don't do are like this. Don't press the injured. Don't press the site where the needle is pricked. Don't apply the any constrictor or the restrictive dressings. Okay, don't apply the any antiseptic solution, no betadine, no alcohol, nothing. Okay, so don't apply anything. And after exposure, you have to, if you are vaccinated, you have to check the antibodies level in your blood. Your antibodies level are more than 10 international unit per ml is there, means yes, that is very good. You no need to take the vaccination, so only the booster dose, means booster dose is required for you. Okay, and if you are unvaccinated, so for the unvaccinated healthcare worker, we need to give the, yes, that is the hepatitis B immunoglobulin also for immediate effect, and complete vaccination we will give to the, yes, the unvaccinated healthcare worker. And for the vaccinated healthcare worker, we will check the antibodies. If it is more than 10 to the power of 10 international unit per ml antibodies are there in the blood of the healthcare worker, means no need for any post exposure prophylaxis. Only we will give the one booster dose. Okay, and in the unvaccinated woman or the healthcare worker who are underwent the needle stick injury from the hepatitis B positive or HbA1c surface antigen positive patient. So here we are using the immunoglobulin plus complete vaccination is the answer for the question. Okay, so if you have any minor to minor doubt about the today's session, means just do comment in your session in the comment box. And who all are watching the live for the video, so now only press the like button for the video. Okay, and we will move forward to the next class in the tomorrow's class. So again, I will come up with a very important and very beautiful questions that is very helpful for your upcoming Norcet. Okay, so we'll meet again in the tomorrow's class. तब तक के लिए जय हिंद जय भारत. Don't forget to press the subscribe button, like button of the class. तब तक के लिए जय हिंद जय भारत. All the best for your preparations.